So controversies that are present in physical medicine, I feel one of the biggest controversies is actually, is there enough evidence to apply these therapies? And so when I talk about the controversies, one of the things I'll do is try to look at how we get our evidence and what the degree of our evidence really is for a lot of therapies. And looking back on the last few decades of evidence-based medicine, you find there's actually a lot more holes in our data than we think. And so I think there's actually a bias against some of the more complex ways of interacting with patients, partly because we don't understand exactly how placebos work. In the last 8 years, we've really documented how strong the placebo effect can be in dogs and cats. And that effect probably relates in part to their interaction with people, and in part to everybody's tendency to be looking for positive changes when you're involved in something as dramatic as a clinical study anywhere, whether you're a dog or a person. So that attentiveness can actually create huge positive changes, which has colored the data even of pharmaceuticals up to this point. And of course, that coloring happens much more when you have a very complex interaction, like anything physical medicine, because you're spending discrete time with an individual with a focus on improved quality of life, improved interactions, improved mobility. So it's a very comforting sort of field that ends up with a very large placebo effect. So I think one of the biggest controversies really is, how do we reframe our approach to be able to incorporate therapies that don't fall within kind of those usual patterns that have to have a clear difference between the effective treatment and the placebo effect. Some of the other controversies really come down to your question, why is motion lotion? Movement is actually very healthy in even very sick individuals, and yet we have this tendency to be afraid of movement. And so for me, a spinal cord injury, a brain injury, all of these patients can be handled gently and safely, but actually still be put into a situation where they are doing some contraction, some motion, and helping mitigate some of the negative effects of stasis. And so certainly the controversies are, do you take somebody who's got a disc, and when do you start moving them, and how do you move them, and how do you do that safely? And my stance is that motion should be started right away. You just have to do it in a way that you understand and you are protecting them. So there's a certain amount of consciousness and carefulness that you can't overlook, and yet the movement itself is very valuable, and it's worth figuring out how to negotiate that.